when as a child I have an impact of something, what we call trauma, a part of me is stuck there. So what I try to do is to bring the person there, to recoup what was there, and all of this fragmentation to bring it back into this unity and create again presence in this moment in time. And you feel that you can handle with whatever is needed to be handled. And it's not about that much fear, because actually right now there's nothing to fear.
Hi, and welcome back to Proven, Healing Breakthroughs Backed by Science. My name is Nick Palizzi, and this episode goes out to the many people who are quietly living with trauma right now as we speak. Millions, perhaps even billions of individuals around the world, depending on who you talk to, have endured some form of deep personal trauma in their life. Whether we're talking about trauma from living in a war-torn country, a broken household, or having to endure the moment-to-moment uncertainty of an abusive relationship. The sad fact is that many of us who are traumatized don't even know it, as you'll learn in the coming minutes. This episode really drives home the importance of taking the time to check in with ourselves, honestly and gently, to find those places within us that may need some form of healing. On a personal note, if you had asked me 15 years ago whether I had any lingering trauma, I would have said absolutely not. It wasn't until I started peeling away the onion on some unwanted behaviors and thought patterns that I realized the extent of the personal healing I needed to do. Please, watch this episode with an open mind and heart to fully absorb the information and potential opportunities for personal evolution and ultimately freedom that it might hold for you. Unresolved trauma often creates an invisible prison that limits our vision of what is possible in our lives. The bars that slowly form are meant to protect us from more pain, but they also confine us, restricting our potential to live and love as fully as we were meant to.
The interesting thing about trauma, whether it's physical trauma, whether it's mental trauma, whether it's emotional trauma, it has the same impacts on your brain. There's a release of pro-inflammatory molecules we call cytokines, which leads to inflammation in the nervous system. And so whether someone's had a head injury, whether someone's had an emotional trauma, many times the impact on the nervous system is the same.
Every injury gets worse if untreated. Emotional injury is no different than physical injury. And the same thing now has been shown in the brain. They've looked at neurosignatures of people having emotionally painful and physically painful experiences. It's indistinguishable. We can basically not tell what the difference is in the brain.
The science is profound. There is loads and loads of science on trauma in the brain, and it's starting to infiltrate where physicians like myself will actually do something called ACEs score. It's a scoring system of childhood trauma, and we know that ACEs are a very large predictor of disease.
People look at ACEs now, which is adverse childhood experiences, and that's like a precursor for early death and all kinds of illnesses. So this is very important stuff.
Synapses that fire together, wire together. When you continue to do something over and over again, it forms a habit and eventually it creates this kind of groove in the brain.
Lots of people are stressed out all the time and have what we call like micro traumas, but they have support. So PTSD, post-traumatic stress disorder, is the symptoms that commonly will follow someone who is exposed to very severe mental, emotional, physical, stressful situation when they don't have good support afterwards. You're always looking over your shoulder, loud sounds startle you, right? All this is based on this overactive increase in sympathetic stress response, nervous system activity over time. That's the post-traumatic stress disorder.
There's probably 8 to 10 million people in the United States who are diagnosed with post-traumatic stress disorder. But I believe all the rest of us have what I call low-grade PTSD. Like, in other words, we think it's normal to be stressed out or have anxiety or have trouble sleeping or have tense muscles and have your mind racing, and you just feel like you have to keep looking at your digital device every 3 seconds or you feel antsy. That we think that's normal now, but it's not.
Our nervous system can view things as traumatic. They can be very personal events, a medical experience, a loss, different events that sort of happen in our lives that hurt can really get stuck in our nervous system at a cellular level.
The good news then is if we can identify where in the nervous system the root cause is creating symptoms from the trauma, there's so many things we can do to turn it around by harnessing the power of neuroplasticity.
You can actually go into the brains of the subconscious and change the message so that your manifestation of who you are in the world, how your health, how your organs process, how you deal with disease, how your immune system functions, this can actually be changed.
We start this episode with a technology that most of us probably don't even know exists. It wasn't until I confided in a friend that I needed some personal healing myself that I was turned on to this powerful and super safe therapy. It's made a huge impact in my life. The technique is called neurofeedback, and it combines the use of a QEEG brainwave monitor with visual or audio cues to help you change your state of mind in real time. Not only is it fascinating, it works.
Everything you think about in your mind, particularly about yourself, but certainly even about the world, everything you think about is relatively arbitrary and is a construction. And so awakening is stepping out of this whole system of thought and realizing that you're not actually limited by any thought about yourself. Which, as you can imagine, if you're within a system, you can't really change the system from within. You have to have an ability to step out of it.
So I do a therapy that is more than 50 years old and is probably one of, if not the most, evidence-based treatment for mental health conditions that we have in the world, and it's called neurofeedback. Neurofeedback is a way to reinforce the brain for producing a healthy combination of brain waves. And what most neurofeedback providers do is a person will be watching a movie and the movie won't play if they don't produce a healthy combination of brainwaves. Some people get something called a QEEG brain map to measure the surface electrical activity of the brain. You are put into a database, and your brain, you get to see the average of your brain waves over time in a visual way.
So when somebody has PTSD, then in terms of neurofeedback, what we're looking at is how that PTSD is impacting that particular brain. And once we determine the particular individual symptoms that the person is having, and we try to correlate them with what's happening in the EEG.
So with somebody with trauma, how their brain is communicating and is a very hyper state. There's a lot of looping thoughts, which is what most people will explain what happens in trauma. And part of that is that activated nervous system responding to sensory stimuli when they shouldn't. It should be in a rest state, except it's in a hyper state.
One of the patterns that we find in PTSD is that there's too much activity in certain frequency band called the alpha band in the right side of the brain, in the right back side of the brain. So we'll put an electrode there and we'll pick up the EEG in that area, and we help the person to reduce the alpha activity in that part of the brain. It can be done in different ways. We can just simply exhibit the activity of the alpha in like a graph, and then we invite them to relax so that the bar graph drops, and so the alpha activity drops, and they get feedback, immediate feedback if they're successful.
Dinging, bars move, points, and it's as simple as that.
So that teaches them to link their body state with that graph in such a way that they can start to move towards a desired body state.
That is operant conditioning. And so here's the thing about QEEGs. We know exactly what the brain does. So when you see a QEEG, you're able to say, this area is working, this area isn't. And you're able to take the guesswork completely out as to what is exactly going on with an individual as young as 3.5 and as old as you want them to be. The database is quite large. The other part about when somebody experiences trauma, for most people, our visual center is in the back part of our brain, and most people who experience trauma have visual flashbacks. So that occipital region will often, over time, start to turn off. So you will see very low activity in the occipital region of the brain, and it's a big indicator that somebody has experienced trauma. So it's a protective mechanism for the brain because it's trying to stop the visual activity in the brain. of the overactivation of a traumatic event that they visually remember. But that occipital region of the brain is the same area where memory is consolidated. So many people who have had trauma have a loss of memory, sometimes around that event, sometimes in that range, or they'll have memory problems in general because that region of their brain isn't working properly. The good news is, with neurofeedback, you can gently turn on those systems in a way where a person feels calm, and it can really support somebody's nervous system who's so activated by trauma to get into a healthy rhythm that they may never have experienced, especially for somebody who has had early developmental trauma. Their nervous system has never been in a regulated state.
People who score high on the ACEs test are expected and statistically shown to have higher levels of chronic disease, early death, and more mental health issues like anxiety and depression. And I fit all those categories. That's one reason why I had to figure out all these ways to work with my mind and body, because I'm like a classic case. I had early heart disease. I had a heart attack when I was 40. It wasn't really the way I was eating. It had to do with being really sick as a child and having a lot of stress and having generalized anxiety disorder when I was 8 years old. When I started doing neurofeedback, I clearly got me out of more depressive, low energy states and improved my focus. My meditations were suffering from what they call dull mind or sinking mind. But that has a certain EEG signature. And I understood it at a whole new level from the inside out. So I was quite impressed with that possibility. And then I saw the research on not only helping with ADD and ADHD, but possibly other disorders as well.
The American Academy of Pediatrics, the certifying board of pediatricians, rates neurofeedback the same level as psychostimulant medication in the treatment of ADHD. It's in their summary every year annually as a treatment that they recommend, but yet most pediatricians aren't recommending it. They don't know about it because we've been relegated as an alternative medicine technique. But neurofeedback has more than 3,000 peer-reviewed studies, and we have tens of thousands of research studies to substantiate its efficacy with everything from anxiety to trauma and a host of other things.
All right, next up on our countdown of top trauma healing methods is an age-old practice that's been around for thousands of years. You'll see various forms of it in a few other episodes because the stack of science behind it is through the roof. I'm talking about meditation and mindfulness. When it comes to trauma relief and recovery, this practice is a vital piece of the puzzle.
So first, maybe we distinguish meditation and mindfulness. Think about meditation as an umbrella term, under which we have many, many techniques and approaches, right? So we could have a breathing meditation, we could have loving kindness meditation, we can have visualizations.
You're focusing on a single target, and that could be the breath, it could be a mantra. You focus your attention, the mind wanders, you bring it back, and then there's that loop that continues.
Mindfulness is a form of meditation. And it's a form of meditation that is focusing on bringing our awareness to the present moment, and then changing the quality of that awareness. This is my definition, and I like it because it's simple. I say that mindfulness is any moment in which our mind and our activity are one. Okay? So any moment in which our mind and our activity are one, we practice and experience mindfulness.
So what happens when we're in meditation is we activate the back part of our brain, and these neural pathways start to come forward, and they shoot forward within the brain. And this is part of that rewiring that occurs. Activates up here in the frontal lobe, and any of us who have had post-traumatic syndrome, which I think pretty much all of us have had something that's gotten to us, and there's those that are more severe than others. What it does is it starts to tell the brain, and it starts to tell the witness, right, the intellect, starts to understand that you're okay. Like, what happened to you 20 years ago isn't happening to you now.
As long as we keep the trauma in the dark, it will keep on influencing our behaviors, our choices, our relationship with life. Most chances it will do this unconsciously, so we won't be aware of the fact that it's doing it, but it will influence our relationships with people, how we avoid certain relationships, how we say no to certain opportunities. It's all there connected to the trauma. And so the practice of mindfulness, especially in the context of therapy, we invite the trauma to move from the dark, from the unknown, from the unconscious, where there's nothing we can do with it, right? We cannot change that which we're not engaged with. Shift the positioning from the dark into light, becoming aware of it, working with it. And I'm stating the obvious, but still this needs to be said. It has to be done with a lot of patience. A lot of patience. This is not about, okay, let's pull it out of the dark into the light and let's work with it. This would be aggressive. This would probably get the opposite impact of what we're looking for. It has to be done with a lot of gentleness and patience and compassion. And this is a gradual process, but if it's done in this way, the patient is then able to slowly, gradually start work with those pieces of the trauma that have been holding their whole life. And then there's this huge question around how do we work with those negative emotions, right? Because most of us, when we meet those negative emotions, when we meet the anger, the frustration, the sadness, the pain, we choose one of potentially two unhealthy interactions with the negative emotions. The first is getting lost in those negative emotions, right? So we get this wave of anger, a wave of pain, and we fully identify with those. It's as if I'm losing my identification as Itai, and I become that pain for a prolonged period of time for a lot of people.
You know, if we get triggered in the moment by a tone of voice, we get triggered by a smell, we get triggered by a taste because of an old trauma that was occurring or that happened to us, when we sit in meditation, this starts to release by the neural pathways that are being created. So it's creating this new way, this new behavior, and it's saying, it's okay, this is not happening to you anymore, and therefore you can move forward. You don't have to keep creating that over and over. Recycling the trauma is what we end up doing and repeating. A lot of what we do is just recycling and repeating.
And this isn't helpful because that doesn't allow me to meet the pain, work with the pain, acknowledge the pain, process the pain. It just intensifies it. And then the other unhelpful potential relationship with negative emotions is the complete opposite. I don't feel pain.
When I first heard about trauma, my thing would have been like, nope, no trauma for me. But the truth is we all have trauma, whether your mother was very angry or you felt like you didn't have a say in your family. Other things might be if you felt like as a young child you needed to take care of the emotional state of your parents. So these are just examples of things that happen in families all the time, and no different in mine. And I had an amazing family.
So those two extremes are not offering us the healthy work we need to do with those negative emotions. And that's when mindfulness becomes a wonderful tool. Again, within the therapeutic context, or sometimes outside the therapeutic context. It's just that therapy makes it much more structured and ensures that we have the support we need for this kind of process. But when we apply mindfulness, we get a new way to relate to the negative emotion. So the wave of pain arrives, and for the first time, I'm not getting lost in it. I'm not rejecting it. I'm observing it. I'm seeing it. I'm working with it. That's hard work, difficult, frequently painful work, because it's easier to get lost or avoid. To confront something in a healthy way, to be able to sit with it, to be able to tolerate it as much as I can. It's difficult. But it's also a very healthy way for us to deal with a trauma, with the resulting potentially depression, and all the negative emotions that come along with it.
I have a history of breast cancer at 25, Crohn's disease at 26, and then I had toxic mold exposure that took me down in my late 30s. And I have had multiple immune deficiencies, health issues. I'm the guinea pig. And a lot of this was related to genetics, as we talked about, but unresolved trauma. And my healthiest self, which I believe today I'm healthier than I ever was in my 20s and 30s, is partially because I've actually looked at those patterns that have kept me back and let them come up and allowed myself to deal with them. Because the cells in the body have an amazing capacity, this is proven by science, to heal. We're created to process toxins, we're created to process trauma, we're created to process anything that comes against us. But we have to give ourselves the compassion, the nutrients, the other types of supportive care like friendships and connection with humans, and even just the ability to show up as ourselves and be confident that that's enough. And those things can really create healing.
We now have evidence that there are connections between the prefrontal cortex and the limbic system, which is the emotional brain, where you get your stress and emotion response. It's an inhibitory connection. And in fact, people who are long-term meditators, their amygdala, which is part of this emotional brain, the limbic system, actually shrinks because they're using it less. So we actually see changes not only in behavior and activity, but actually in brain structure over time as people develop these skills of emotion and stress regulation. And emotion and stress are huge contributors to one's experience of pain, etc. So we're starting to understand the neurophysiology of how these practices are working. And it comes from that meditative component of the focus of attention.
We see that mindfulness is shortening the length of time it takes for us to recover. And if that's the case, for almost no cost, without a doubt, mindfulness would be highly cost-effective as we offer it to patients.
When we were doing all the research for this series, digging through study after study, sitting down with doctors and scientists from the major medical institutions around the world, some of the healing breakthroughs that emerged were to be expected, but others were an absolute shock to us. Not that we hadn't heard of them, we just didn't realize the level of scientific proof there already was for their use. This next trauma solution fits into that description. We're about to venture into the world of expressive art therapies, a realm of complementary medicine that is unknown to many. When you think of music, what feelings does that conjure in you? Pleasure? Relaxation? Fun? Did you know that this basic part of life that is known to every culture around the planet can also be used to heal? This one really blew us away.
So music therapy is an evidence-based approach to healing. I would like to say that it's the intentional use of music in a clinical way. And so we use music improvisation, singing, songs, vocal work, songwriting, song lyric analysis, different musical interventions to enact change or to be able to bring a sense of cohesion back into a body that is out of balance or fragmented in some kind of a way.
What's great about music therapy is it's not like, let's talk about your trauma. Trauma is, as we know, is stored in the brainstem. It's like very subconscious and it's protected. So it's really hard to reach just from cognitive talk therapy when you're just in the cerebral cortex. Music is processed in the whole brain. So it's a really great way to get the whole brain involved and have a true healing. Because it's one thing to understand ourselves and talk about it, but it's a very different thing to use neuroplasticity and help rewire those neural pathways to truly heal.
A lot of people that I work with have been over-therapized, or they've been with therapists who really maybe are not as trained as they could be. So there's a resistance that begins to result, particularly with any kind of drug and alcohol treatment. So music is non-invasive. And it's a beautiful way to begin to start the work and do the work of helping the client find their way back to themselves.
Creativity is essential because it takes us out of the rational mind, and so you tap into this multi-dimensional being that you are.
A song is a container for emotion, and songs hold emotion. And songs validate our emotions. And so they say the things that we are not able to say or don't want to say or can't say or don't have the language to say. So if I'm working with the client and I do an assessment, one of the first things I'll ask them is, well, what's the first song that comes to your mind when you think about your mom? And what's the first song that comes to your mind when you think about your dad? You know, what was your favorite song from childhood? And immediately the guard goes down because we're just talking about music. We're just talking about songs. Meanwhile, though, I'm able to tell by which song you choose, that tells me something about your relationship with your mother or your father. If you choose Papa was a Rolling Stone, for example, that's a clear message. There's something there, right? There's been a lot of research actually done on music therapy in terms of what they call unconscious song recall. And that is that, in essence, songs are a type of archetype that exists in the unconscious mind. So by me using songs as a way to connect with the client, I'm actually digging around in your unconscious. Then I'm actually helping to bring what's in your unconscious into your conscious. Why is that important with addicts? Well, because a lot of times there is a great deal of trauma that addicts are bringing in to the room. And a lot of that trauma is locked away in the unconscious and in the subconscious mind. But if I can use a song to help to bring that forward, and I have the training to help to process it once it comes up, then we're getting somewhere.
Music therapy is extremely effective with trauma. Rhythm is so basic to our humanity. It's in the brain stem. So you use rhythm to help heal and reprogram the mind. And then you pair it with lyric, and that's frontal, right? And then you have melody and harmony. So you have the auditory cortex as well as the hippocampus. You're getting the memories, the emotions, which is the amygdala. The music is integrating this whole brain. And that's why we really want to use music, is because we need the whole brain to communicate.
I work with people that they have not at all intention to heal. They try hard, but there is some unconscious obstacle. Their energy is so stuck that only the vibrational element of sound, which is a wave that hits your body, and then by sympathetic resonance, meaning by you as a body that is already vibrating, meeting that vibration, your body starts to oscillate a little bit more. And in that oscillation, there is information that is released. And there are emotions that are released. But emotion is energy in motion. If you are so stuck in certain kind of patterns, energetic patterns, it's not easy that energy gets into motion. So they are like, oh, I'm not really, I don't know. It's like there is no energy in motion. Where instead, some people, it's even just by a single sound, they are like, wow! Instead they are open.
And there's a lot of studies on using percussion and drumming for healing. Amazing studies. It's been shown when you use certain protocols to boost our immune system and reduce stress. So we're talking about we need to reduce stress, right? Especially in trauma scenarios, and to build resilience and to help prevent disease. And drumming does that. So using the live instruments, you're still getting the vibration, but now you're using that principle of entrainment, and that's giving you a sense of community and support, which is very, very important when moving through trauma, right? We need to feel like we have community and healthy relationships. When you play music together, there's almost, I don't know of many experiences that does that faster and more effectively.
So simply like I come with a drum, with a beat, and then I allow you and the rest of yourself to start to beat in the same rhythm. So that circular balance and continuous movement, it creates harmony. It creates healing.
Something else that's very important to note is that for the same exact reason that when you get in your car and a song plays and it completely activates you emotionally, that's the same thing that happens when you are in a music therapy session. Songs can trigger patients. I had a crazy situation once where I was in a music therapy group and we were doing a song tapestry where people were sharing songs that meant something to them, and we were weaving them together in the group. And as we're playing a song, the client starts banging her head on the back of the wall, like kind of softly first, but then she does it more and more intensely. And I talked to her, and what emerged for her was a memory from childhood, from her father abusing her sexually. And she didn't necessarily have a full memory of that event. The song triggered the memory because I guess the song was playing at the time. So I then was able to have to like sit and process that with her and bring in her other team members to begin to process that memory. So yes, it's good that that happened because the song brought up the trauma. We need that. But it's an example of how we have to be mindful and diligent as music therapists that songs trigger memories.
So it's almost like a soul retrieval. This is what I do usually. So it's not about, for me now, let's go back there and let's see what is the source, what your mother did, It's okay, how did you feel back then? Oh, I felt that I was okay. Can you see yourself now? Can you bring that little one in here? And then you know that now you're safe. So it is also to bring people into this present. And in that presence, you can't imagine how that energy, and that's again emotions. So the energy keeps moving again. It's not stuck in time.
Trauma gets locked into the fifth chakra. So the throat chakra is the one that I work with as a vocalist, as a vocal psychotherapist. Vocal psychotherapy is, by the way, a modality, a sub kind of category of music therapy that was invented by Dr. Diane Austin. And she invented it because she recognized that when she was doing voice lessons, that people would inadvertently just start opening up to her. So the way I work with people with the vocal psychotherapy is mostly side by side in a kind of a sitting next to each other kind of a way and at a piano. And I'll just play some chords and begin to open up the space for breathing and for vocalizations and in a very improvisational way. So I begin that way because words, again, are coming from that other space. And so we want to just begin with sound. And just by sounding, begins to bring us back into that primal space of feeling. The energy begins to move and stuff begins to come up. So from that, the stuff that starts to come up may be words. So then a client will begin to say, mom, mother, or daughter or father, then words begin to come up. And so then we do a type of free association of singing. And so Freud talked about free association. He would sit a client on a couch and they would just, kind of freestyle with words. And I would always say that hip hop freestyle is a kind of a free association too. It's all about tapping into the unconscious. The other thing that's important about this therapeutic process and why it's therapeutic is because we're not working from a performative place. So that means people who have trauma around the voice, people who have been told, you can't sing, keep your day job, or whatever those phrases are people throw around haphazardly that really land and stay with us. We're able to actually transcend the egoic experience of that because we are just sounding. We can actually trick the mind by just saying, we're making sounds. So oftentimes what happens is that scene that I just described, me and the client sitting at the piano, us singing. If you're playing music in a holding pattern, then you're creating what is called a lullaby. That lullaby, from an energetic, sonic perspective, is actually recreating the womb. Whenever that safety is attained, that is an invitation for unconscious material to begin to emerge.
So one of the things about trauma is that it is stored in the right brain. So if we're working in solely talk therapy, people don't have memories, they don't have a narrative often, and they haven't been able to fill in a complete narrative, which is very useful and healing for them to do. So if the trauma is stored in the right brain, then it's the right brain modalities that will be really helpful and effective for healing. Art therapy is right brain. So we start with the right brain intervention of the artwork, drawing, painting, collaging. So when you start to do any kind of artwork, you're bringing forward information that is from your preconscious or your unconscious self, and then it's there for you. And that's the beauty of it, because that's where the healing comes in. And then what happens is that as they look at it and we get to have a conversation about it, the left brain comes on board. And so that brings to bear this other aspect of what is the role of that therapist in that setting. So one of them is creating a safe place, a safe relationship for the client. So as they maybe work with traumatic material, for example, they're now working with that traumatic material with the therapist. So they're not as likely to get pulled back into the trauma because it's now a safe place. So the relationship is very, very important. The therapist also has a big role to play in intuitively deciding what directive to offer to the client. That's something that is a decision based on what is going on with the client, what they just finished working on, where they're headed. If somebody is dealing with PTSD, one of the earmarks of that is that the memories are as if they just happened today, even if it was 20 years ago. in order for it to take its rightful place in their history and in their past, they need to go through this process of being able to express all of the feelings, which are usually very intense feelings of rage, of fear. And then when they get to that place where they're having a conversation with the therapist and they're putting these puzzle pieces together, then that integration, that final phase happens for them. So from my perspective, art therapy is one of the more powerful modalities to use for treating and healing trauma.
I hope you're enjoying tonight's episode. We'll get right back into it in a second, but I just wanted to take a quick moment to tell you how you can own the entire series. Below this video, you'll find a link to the full Proven docuseries, as well as a bunch of powerful bonuses that you can bring into your home at a special discounted price. This also includes a Proven companion guidebook that's jam-packed with powerful takeaways and action items from each episode. It's loaded with deep dive wisdom that isn't included in our free premiere. On top of that, we're hosting 2 live Q&As where you can ask questions directly to some of the renowned experts you see in these episodes. If you're interested in bringing these powerful, proven healing solutions into your life, it's well worth checking out. Plus, the proceeds from your purchase will help us on our quest to unveil new breakthrough medicines and share this information with the world. Make sure to check it out. Now back to tonight's episode. Have you ever been in a bad mood, feeling a little low, and then a song comes on that makes you start tapping your toe, and suddenly things start feeling a little better? What is that? How does simply moving our body to a rhythm we like dissolve negative thoughts and sensations? More importantly, can we tap into the power of movement and dance to heal our body and mind? Well, the verdict's in, and as you might have guessed, that's where we're going next.
I worked for the Catholic Church for a year as a dance therapist. This was 1986, so it was right in the middle of the sexual abuse scandal, and I was then in Boston. So it was a retreat center for what they called emotionally impaired clergy. Part of it, I feel like spirituality, as well as many other things, is also in the body. And so I got to work with, I'll never forget, one priest who was part of 4 generations. He'd been abused. He abused somebody who abused somebody else. He was a well-known public figure. This was all a retreat, very secret. People were there, residents were there for about up to a year, with community meetings and individual therapy, group therapy, massage therapy. In a movement session, I'll never forget, we were doing one about sort of raising your arms up to the sky, and he was crying, and he said it was the first time he experienced his body as anything other than a problem. So this was a Catholic priest. There were nuns there also who said they'd never been touched. They really responded to massage. We did sort of play therapy things, and they said they never had happy childhoods, some of them, and never got to play or improvise or be creative. So all these things really gave them a whole new way of using their bodies and their imaginations that wasn't part of sin, that was healthy.
With trauma in the body, even as it relates to the mind, the emotions, our experiences, our relationships with other people, we start to form belief systems about ourselves that, well, I wasn't good enough, I wasn't strong enough, I failed. And that can feed into earlier messages that we have from earlier in our lives, but they get too fixed in us. We start to believe them too much, and we lose something about that connection with life that's just open and free and feeling spacious and fluid, and what to me was what drew me to dance in the first place.
And trauma actually can change the way our body shapes are held. In fact, you talk to somebody who has been in a traumatic experience, and sometimes those traumas are held within muscles of their body. And so in order to avoid those feelings, they can find themselves constricted in ways that are quite uncomfortable and even can take some breath away.
There's plenty written about the relationship between healing arts and the resolution of trauma in the body. People are doing movement therapy. Dance therapy is also part of that. So anything that helps the body be more free and available for movement is going to be related to this question of, body, mind, trauma, resolution.
There are so many different ways the dance therapists work with their clients. I really like to use metaphor. As I kind of think about constriction or lack of breath, I can help somebody to understand what it feels like to put their body in this position, and then an image may come up. And for example, I had someone who was talking to me about feeling this tightness in this area of her body. And so the metaphor that came up for her was that she had a bird cage. And in that bird cage, it was tightly, this iron bird cage that was closed tightly, and the bird wasn't free. And she was so afraid to let that bird out. So if we could help her to understand that maybe that bird cage had a hinge and a door that she could gently crack open to feel if it was safe, she could get some sense of what that breathing was like. And in the minute we did that, I noticed her posture change. I noticed kind of the way her carriage was, her breath opened up, and then really started to feel like that she could let that bird out. And that bird for her was kind of her child, her freedom, her hope, in a way that had been so tightly held for her.
Columbia University had a folk dance research project. They were looking at immigrants coming over to the United States. So first Italians started talking with their hands and their whole bodies, and after a generation, less movement, until the very British thing is to be upper class, to be male probably, you don't move any of your body, you just move your mouth. That's considered control. That's considered upper class. So moving your body connects to sex, which makes people very uncomfortable. Lower class. So the sort of the Western ethic value is control of the body.
In the first grade, I came in there, and the first day I can remember the teacher saying, "Don't move. Sit still, hold your mouth shut," so you didn't talk. And from that, a lot of us would caught at this, as we get on, I learned to tense. And so when I'm learning to tense like that, and that's learning also. And the learning then becomes habit. And we're rewarded for those habits.
Even living in our bodies is dancing. And I work also with people who might be wheelchair bound or unable to move at all. And I've found that if we can invite them to see their body as a place that has movement, and that movement alone is a dance, then it can feel so freeing.
What we train in dance therapy is if you're having an emotion, I feel it too. I can identify your depression or your whatever it is, not through my eyes, but through a feeling in my body that then my brain interprets as what you're feeling. So, and we train the body to, we call it merging and separating with other people's bodies. We mirror them, we feel what's emerging. So now we understand that the mirror neurons are firing even if we're just sitting in a chair listening. If I rehearse a tennis swing or something, my mind sometimes doesn't know the difference between the imagination of it because the neurons are firing. If somebody is awkward about moving or something, I might have them imagine, you're here and then you walk into a room and then this happens. It's sort of as a rehearsal, but you get some of the same effects.
So if we think a little bit about dance throughout the history of humanity, dance used to be a place where traditions, rites of passage, emotions, chants for rain, ways that we could, as a community, come together and celebrate, grieve, unite, And so dance took this very communal effort, and it was so important in communities. In a way, it is medicine. We know it to be medicine. We know about the endorphins that are released in our body when we're dancing, and we know also the benefits of dancing with other. Connecting with other can feel so strong and powerful, using our bodies, using our nonverbal communication, and uniting in that way.
Kurt Sachs, who was a dance historian, once said dance is the mother of all the arts. Dance was used as preparation for war dances, even the hula, rehearsing movements of the canoe, of canoeing and paddling, but they were also readying themselves for journeys. So it was like behavioral enactment. I see that all as medicine and health.
But then throughout history, dance became more and more constricted, especially in Western cultures, to being a very prescribed, very performance-oriented art. Around kind of the turn of the century, in the 1900s, dance started to be used, particularly in Western culture. Modern dance was much more about expression and process than it ever had been. And so when that came about, there was this sense of improv, which was kind of unheard of. And all of a sudden, there was this accessibility that a dancer didn't have to just look a certain way, but a dancer could be anybody. And so at that time, it started to be studied. It started to be studied in hospitals and with children. This sense of once people started to move their bodies, once people started to connect through movement, once people started to recognize the emotion that could flow once they were moving and dancing, they were feeling better. And so it became easier to study it that way because it was proven that people could find some sense of wholeness and healing through moving. It felt much more authentic in some ways than sitting in a chair across from somebody and talking and being asked questions. And yet, dance therapy is informed by psychological theories and traditions as well. Even, that Freudian sense of free association, we can free associate in movement.
On the one hand, it's really about improvisation. The task of a therapist is to support what's emerging. I work with groups and individuals, and that's the same. And I think in one of the questions is what's the important principle? And as always, it's the relationship. So that means that you don't come in with your own agenda, and that you're there really to help give voice to whatever emotion or themes are emerging in the group. So a typical group, if I'm working with a group, is usually about an hour and a half to 2. Takes time to get the group going, although I can do less or more. A warm-up, because I saw over and over people were walking into the studio or the room preoccupied and gabbing on their cell phones, and it's very hard to start a journey from a non-centered place. Lately, for the last couple of years, and I've been working in Jordan with refugees, I do it there too, starting with some meditation. Just quiet time to come back to yourself so that whatever happens comes from a different place. And for trauma, this is really important, but I think more and more I've discovered it's important for all of us, feeling the stability of the body, feeling the feet on the floor, getting into your weight, which developmentally takes you out of your mind and kind of back into your body on like an infant. So you're really recreating the stages of development. So just simple weight, basic, and then tuning into the breath. So we do a lot, then beginning to move into relationships in the group, which is then kinesphere, it's personal space. Like, this is my comfort zone, I don't want anybody closer. Or this is my comfort zone, or I'm really happy and free about moving in space. And then setting boundaries. And after you've set your boundaries, then you can begin to invite relationships with consciousness. Eventually, the group gets going on its own, connecting to something, being able to participate in something larger than yourself, where at that moment, it's not clear who's leading, who's following. We're all in something together. And then we can all feel that, and then something usually shifts in the room.
There is this overlap between kind of that movement, that exercise science, as well as the dance and the creativity. And it's kind of this perfect marriage. There are a lot of body-based psychotherapies, and they all kind of embrace that same idea that our body has wisdom, and that by healing the emotional experiences that we hold in our body, we are actually healing ourselves holistically and psychologically.
When I tell people to, after we finish a class or my hands-on movement on a table, and I'll have people, come up to standing. And I'll ask people, how do you feel? What do you notice in standing? And then they'll say, well, grounded. And I'll, explain, well, probably the grounding, again, is because you now recognize, instead of holding yourself up, you've let that go and you're letting the ground support you. Now, I had one gentleman in my class. He was in my class 7, 8 years. He brought his whole family to the class. He was 86, 87 when he started. By the end of by even 2 years, he was in this class consistently, and I noticed, and he noticed, he was up like this. Spontaneously came up here. But after one class, I walked up to him, and again, he was, by this time, 88, 89, something like that. And I stood in front of him, and I said, how are you feeling? And I thought he was going to say grounded, like everybody does, in Boulder. And he looked at me, and he said, I feel secure.
For thousands of years, we humans have lived in very close relationship with the natural world. Until about 150 years ago, the majority of people worked under the sun, whether in open fields or further back, hunting and gathering over miles and miles of terrain each day. By the way, hunting and gathering is not some ancient practice that no longer exists. There are still hunter-gatherer societies on this planet today as we speak. Our civilization has evolved dramatically over the past 150 years, and the outside world looks much different than it once did. But while city skylines are punctuated by skyscrapers and in our homes, glowing flat-screen TVs flash images from far away, these bodies we were born with are still the same model that the ancient Greeks, Egyptians, Incas, and Romans were outfitted with. The one thing those civilizations all had in common was close connection to nature, including many varieties of plants and many varieties of animals. It may come as no surprise then that the science is now conclusive that our skin, muscle, bone, blood, and the nervous system interwoven throughout it needs contact with the natural world to be healthy. This is not theory, this is fact. And when it comes to healing from trauma and related challenges, this couldn't be more true. In this final segment, we're going to be diving into a proven use of nature-based therapies to ground and recalibrate the mind so that we can process memories and experiences that would be difficult to acknowledge and overcome otherwise.
Trauma is absolutely one of the things that often brings people into therapy, or is often one of the things that, when people find themselves in therapy, begins to reveal itself. And outdoor-based therapies, I think, can be really useful in regards to trauma in a number of different ways. One of the hallmarks of trauma is that it kind of turns our world upside down. Whatever we've taken to be like life as we think it should be is turned up on its head. So, one of the criteria for PTSD is that there's been some kind of event in which there has been an experience of, literal threat to self or selfhood. And that is what often happens for people if they find themselves in a situation where, literally the ground shakes underneath them. When we then talk about outdoor-based therapies and the therapeutic impact of outdoor-based therapies on trauma specifically, what we may be talking about is the impact on any one of those specific areas of experience, whether it is physical, physiological, whether it is about more of the psychological, emotional, mental, cognitive, social, or whether it's on that level of what we might even call the more spiritual.
We have a nature deficit. meaning we need to get out into nature. We need to walk on the beach. We need to walk amongst the trees because we are actually bombarded with negative ions that energize our cells, that give us the energy we need in order to produce energy in our bodies as well as move these enzymes in our body. So I tell people all the time in my practice, I'd rather have you go for a walk in nature for 20 minutes every day than take an antioxidant. It's that powerful. If you take off your shoes, it's even more powerful, getting that good magnetic frequency into your feet from just the dirt on a trail, like anywhere that you can find it, as long as it doesn't have pesticides and all that on it.
For me, the number one thing is being in nature, right? It's trying to find some wild place. You've talked about Shinrin-yoku, which is forest bathing, but the deeper you get into the forest, the more likely you are to get that kind of energy. So even if it's just a brief walk into the deepest forest you can find in your neighborhood, that's enough to make a difference. So I really think that's critical. Now, that kind of ties in with research on the microbiome, right? As we have these depleted microbiomes with less diversity, and it's been shown that engaging in green space activities or blue space activities where you walk by the ocean actually picks up microbes from nature, from the water, and that becomes a part of you. So the healthier your microbiome is going to be, indirectly, the less stress you're going to have.
That's why walking outside has become kind of a treatment in Japan. Have you read about that? To go walk in the forest for 20 minutes a day because they have proven that it supports healthy immune system.
Because if you've got a microbiome that's depleted, it's actually making stress chemicals. So anything you can do to lower those stress chemicals, the catecholamines are one example of that, the cortisol, anything you can do to kind of think about lowering your toxic load of stress chemicals is going to be beneficial.
There is a grief group I recently was in contact with for children who had experienced the death of somebody in their families. And it was a grief group where the children got to work with horses. So it was an equine-based group for all these young people who had experienced what actually for all of these individuals in this particular group had been really a traumatic death. Actually, it was a parent for all of them. And just from an outside perspective, you know, personally, but also clinically, being able to see that just the contact with the horses, with these animals, has such a profound impact on the nervous system. And we know that from research, that just for these children to be able to groom the horses or braid their hair or, you know, just pet them, put their own little bodies against the big bodies of these prey animals. You know, what we've seen is that helps the nervous system move from that fight or flight kind of state to the more relaxed parasympathetic state where their heartbeats are lower, their respiration is lower, they're able to kind of think and be very present to what is happening. You know, and the children themselves, what they express, because they don't necessarily know those details, is just how good it feels to get to be in contact with the body of these very large living beings. The approach itself is not just about the contact with the horses, but also about you know, the clinician's ability to make sense of the interactions that these children are having with these animals from a therapeutic lens, right? So there's all these parallel meanings that are happening that the client may not be aware of, but that the therapist is very mindful to, right? So some children being very afraid of these animals, some being very kind of aggressive, you know, maybe big energy or loud or wanting to move towards them very quickly. And of course, you see the way that the animal kind of responds. And there's so much learning there about being in contact and being in relationship. So again, when we talk about the relational disruptions that can happen with trauma, this opportunity to come into relationship with a living being and have a therapist who can help guide that, who can help point out certain patterns that they might be seeing. As prey animals, horses are naturally afraid of us, right? They're afraid of us. They are herd animals, so they want to be together. They don't want to lose their other, their community. And so there's a lot of parallel process and therapeutic interventions that are possible here with a trained therapist who also knows what the history is of let's say, this child or an individual, the trauma history, who can then be thinking about that and working with that quite directly as they watch a child who themselves is terrified of the horse and just wants to stay in the corner, right? And maybe the horse approaches them. Or the child who's learned how to manage what's happening in their nervous system by, not really attending to what is this other being wanting and approaching very quickly and getting information right away, right, from the horse of like, wow, look at how the horse goes and seeks out other horses. It also is such a common feature of a lot of outdoor-based therapies that we work in groups, that's one of its profound impacts, is what happens when we do something, especially if we do something that's hard or maybe scary, outside of our comfort zone, which for a lot of people, being with horses is that, or rock climbing, or even just going for a hike. That we also know that increases the sense of group connection and solidarity when we have to go through something hard together, right? Brings people together in a very profound way. And again, with good clinical intervention happening at the same time, clinicians are going to encourage that kind of coming together. So if one person specifically is struggling, there's going to be a kind of support around what do we do here? How do we support this person? How do we hear them in terms of what they need or what they don't need? So one of the things I think is really exciting about this field right now is that there is more scientific research to back up something that I think we have intuitively known and felt for a long time, which is that there is a positive impact to connecting with outdoor environments in all kinds of different ways. A number of the findings that we see scientifically now speak to a general kind of engaging of what we call the parasympathetic nervous system. So if we talk again about what happens when we are more in connection to this very busy kind of pace, whether it's through our technology or through just our incredibly busy kind of lifestyles that we've created, what we're finding more and more is that people are living in a kind of low-level, constant fight or flight response. And particularly depending on the community that you live in, your social cultural location, what are the external experiences that you might be subject to if you are having to, navigate experiences of trauma or stress on a daily basis, then absolutely your system is operating from more of a sympathetic nervous system response in a constant way, which is the fight, flight, or freeze response. And what we know is that that's an incredibly useful capacity that our bodies have, but it's not meant to be a way in which our bodies are functioning constantly, long-term, chronically. And so just about every modality within outdoor, kind of the outdoor-based therapies, whether we're talking about working just with a nature element or spending time outside or working with an animal or working with plants or gardening or whatever it might be has been shown to increase parasympathetic nervous system response. So that's our nervous system when it's just taking care of homeostasis, calm, relaxed, not having to be hypervigilant to any threats that might be in the environment. And that's actually how we ideally want to be operating, moment to moment. There's also been quite a bit of research done on programs that are what we call more wilderness therapy or adventure therapy. So where folks are being taken out for extended periods of time, or where certain outdoor activities are being used with really specific therapeutic, kind of from a therapeutic lens. So that might be rock climbing, river rafting, canyoneering, things like that. And where initially you might actually see an increase in stress or anxiety because those kinds of activities or environments may feel overwhelming, a little bit scary. Again, what's been found is that over time, that settles down, that people get comfortable, and that what we see is a really strong increase in self-esteem, confidence, sense of connection to group, because those kinds of programs often happen in group settings. So all of the positive impacts that we find when people are in group settings and doing therapeutic group work, we find in those environments as well. Often we're talking less. The environment itself is going to do a lot of the work. And so, especially for someone like a child, where putting really unformulated pre-verbal experience into words is pretty hard, to just be able to make contact with an animal or to just be outside is in and of itself a really supportive, appropriate kind of approach. And for many people who are able to describe this, again, it gives them a sense of connection to something bigger, a sense of self, a sense of themselves that often feels less fragmented. There has been qualitative research where people describe just, I felt more at peace. I felt more grounded. I felt a sense of connection to something bigger than myself. And again, when we talk about what gets taken away with trauma, it's often those things: a sense of peace, a sense of ground, a sense of connection to something that I can kind of lean on that's bigger than myself.
What have we learned? Okay, this one was deep. First off, we found out that your brain is changed from trauma, be it emotional or physical. The resulting biochemical scars inside you actually look the same in any type of trauma. Research funded by a big insurance firm yielded an extraordinary revelation. ACEs, which stands for Adverse Childhood Experiences, do relate to later life disease in many different forms, not just mental. This means that exposure to and experience of trauma in early life can turn into pathology as an adult unless the trauma is processed correctly. Our first modality was neurofeedback. This is a form of brain-based biofeedback that is well studied and evidence-based. With neurofeedback, you can learn to reproduce healthy brain waves at will. When a person experiences trauma, a loop in the brain is formed and one can easily recycle disturbing thoughts. Neurofeedback basically trains you to form a new neural pattern that ends this painful loop and gives you back your mind. It's so effective that the American Academy of Pediatrics has recommended this to be as effective as psychostimulatory medications for the treatment of other disorders like ADHD, as well as trauma. Next, we moved into meditation and mindfulness, distinguishing the two. Mantra, breath, single focus, and mindfulness are all forms of meditation. It's all about attention here. Where do you place it? Or better yet, do you have control of it? In PTSD, you may relive a trauma on a regular basis without feeling a control over your attention or thoughts. This can feel painfully intrusive. Mindfulness empowers the brain to interrupt that loop, that cycle, that pattern, and forge a healthier, happier realm of thinking, meaning you're no longer helpless to these intrusive thoughts and negative emotions. Next, we dove into expressive art therapies in the form of art and music. This goes way beyond belting out a song in the car, although that can for sure be therapeutic. As an evidence-based medicine, therapists here are extremely well trained to facilitate traumatic processing and use non-verbal expression to allow movement of the emotions that have become stagnant within us. From song tapestries to prescriptive playlists to sonic lullabies, we all know the power of music, sound, and vibration. You simply feel it. The science is now all over this, and whether it's drumming, listening to lyrics, or getting in touch with the sound of your own voice, music is therapy. Art therapy comes in so many forms, using materials to express yourself, be it drawing or collaging or crafting anything. Even medicine cannot deny this is now evidence-based. The research is out, and it's in strong support of art therapy, which can now be found in hospitals, clinics, and treatment centers all over the world. Our next modality was dance and movement therapy. Somehow, we've forgotten in our day-to-day lives how to relate to and flow with the force of gravity, how to truly be in our human body. When we experience trauma, the body builds up a tension that we might not even notice. We become unaware in a way. Movement and dance work to loosen and liberate this tension, and also the emotions around it. We also revisited the Feldenkrais method, where neuroplasticity was emphasized as a mechanism of healing. Expanding your movement expands your mind, your perception, your awareness. Research now shows that exploring movement, much the way you did as a baby, actually builds neurons through neurogenesis and new pathways through neuroplasticity. Lastly, we end at the beginning, nature-based therapies. The simple act of being in nature is absolutely therapeutic. I don't think most of us need science to confirm that, but if you do, there's plenty of it. Shinrin-yoku, or forest bathing, has been well researched in Japan, as has wilderness and adventure therapy in other regions of the world. The verdict is in, and we now know that simply being in a green or blue space or touching natural elements of wood, rock, or bark can have a marked effect on our mental health. More advanced nature therapies may include animal-assisted therapy. Think of horses, dogs, cats. Again, many of us already know intuitively how therapeutic being around these beautiful beings can be, but the science is now there to support it too. A big component to healing trauma is relationships, and learning to establish a relationship with nature or an animal can be extremely restorative. Being in a wild place or in connection with the remarkable creatures of this planet connects us to the natural biorhythms of where we come from, and that is very real medicine. Okay, 2 more things before we go. 1, do you want to bring all of this healing knowledge into your home and help support our quest to find lost medicines that can heal a world that is hurting? Click the button below this video to check out how you can get the full Proven documentary series plus a bunch of powerful bonus resources at a discounted event-only price today. When you buy it, you'll not only have lifetime access to everything you've seen in these episodes, might I add, in 3 different formats, video, audio, and text transcript, but you'll also get ebook guides on how to use alternative and natural medicines for specific conditions, extended interviews on topics that weren't covered in the episodes, and 2 live Q&As with a couple of the esteemed experts from the series. It'll only be available at the discounted price during this event only, so make sure not to miss it. Last but not least, what's coming up next? Tomorrow night, we will be covering what many believe is the most devastating disease of our time, and we don't take this lightly. Episode 8 is dedicated entirely to cancer, a condition that has affected almost all of us in some way, whether it was a friend or loved one, or even ourselves. I have to say I'm extremely proud of this upcoming episode because unlike a lot of the fly-by-night resources that are out there, this episode takes a very careful and rational approach to the alternative and natural treatments for this dire condition. We cover not only the promising approaches that are being used around the world for varying types of cancer, but also the therapies that can really complement some of the effective modern interventions that exist. In other words, an integrative approach. This one's going to be real, and it's one I highly recommend watching. Only by standing together can we bring an end to the serious diseases of our time. See you tomorrow night.